Assalamualaikum warahmatullahi wabarakatuh, and thank you for joining us today for this webinar session. On behalf of the Safety, Health and Environment National Authority, SHENA, I would like to welcome you to this first webinar presentation organized in conjunction with World Day for Safety and Health at Work 2025. My name is Rozan Azlan, and it is my pleasure to present to you some reflections on the International Labour Organization's, or ILO's, Global Report for World Day for Safety and Health at Work 2025. This year's ILO report, Revolutionizing Health and Safety, the Role of AI and Digitalization at Work, offers some interesting and thought-provoking insights into how technological advancements are shaping our understanding and approach to workplace safety and health. At the outset, I would like to take this opportunity to share that the information presented in this webinar is not a policy or academic presentation, but a perspective piece. After considering the information we have shared, those interesting issues are still open for interpretation and are meant to encourage discussion from yourselves, especially on the theme of AI and digitalization in the context of workplace safety and health. We will be taking you through several key areas. We'll begin by delving into the core themes of the ILO's global report. Following that, we will touch very lightly on the current occupational safety and health and environment landscape in Brunei Darussalam. We will then explore the potential challenges we may encounter, as well as opportunities that artificial intelligence presents for enhancing OSH in our local context. Finally, we'll wrap up with some key takeaways and ways forward. Starting with a little bit of background on the ILO's global report. This report is released annually to coincide with the World Day for Safety and Health at Work, which is observed every April 28th. The 2025 report, launched just recently on April 23rd, focuses on revolutionizing health and safety, the role of AI, and digitalization at work. The report itself is structured into two main parts. Part 1 examines how digitalization is currently transforming safety and health at work, highlighting emerging technologies that are already making a difference in worker well-being. Part 2 shifts focus to addressing OSH in this rapidly evolving digital era, looking at the necessary policies, identifying existing gaps, and emphasizing the need for collaborative efforts on a global scale. A key message woven throughout the report is the urgent need for proactive policies to effectively address the new risks that come hand in hand with these technological advancements. Part 1 of the report brings into focus on the tangible ways in which digitalization is already impacting our workplaces. For instance, automation and advanced robotics are no longer futuristic concepts. They are actively streamlining tasks and reducing worker exposure to hazardous environments. Consider industries with repetitive or dangerous tasks. These technologies are offering real improvements in safety. Furthermore, we are seeing the rise of smart OSH tools and sophisticated monitoring systems. The definition of these goes beyond passive data collection. They enable real-time hazard detection, allows for proactive safety management and intervention before incidents occur. There is also the transformative potential of extended and virtual reality technologies on worker training, such as immersive simulations that allow workers to practice high-risk scenarios in a safe and controlled environment. This is not only enhancing learning, but also significantly reduces the risks associated with on-the-job training in hazardous situations. Beyond physical safety, digitalization is also changing how work is organized. Algorithmic management and optimized task allocation contributing to an improved work-life balance. It's important to acknowledge that digitalization also brings changes to work arrangements, such as telework, platform work, which, while offering flexibility, can also introduce new challenges that need to be addressed. The ILO's global report notes that it is vital to recognize the digital transformation. It isn't without its own set of potential risks. In embracing technology, it is important to be mindful of risks to safety and health that may arise in its use or adoption. For example, usability and fit issues with wearable technology can lead to physical strain. There are privacy concerns and potential stress from perceived monitoring. Digital displays can cause visibility and balance issues, visual strain, and cognitive overload. Increased surveillance and monitoring, work intensification, and issues of fairness and bias in algorithmic work management are potential psychosocial risks that must be considered. The ILO has presented a table of examples that aligns technology with the traditional hierarchy of controls. For those who are unfamiliar, the hierarchy of controls is a system used in occupational safety and health to minimize or eliminate exposure to hazards. At the top, the most effective is elimination. Here, technology can help us physically remove the hazard altogether. Examples include replacing physical entry into hazardous spaces with drones, or use robotics to automate repetitive or dangerous tasks. In substitution, use safer alternatives. This might involve using nano-engineered materials to replace hazardous substances. For engineering controls and isolating people from the hazard, technology offers solutions like immersive VR simulations or training, real-time monitoring systems for confined spaces, exoskeletons to assist with heavy lifting, and computer vision to identify ergonomic risks. For administrative controls and focus on changing how people work, digital work permit systems, gamification of ergonomic training, and VR/AR training for hazard recognition fall into this category. Finally, we have PPE or personal protective equipment, which is the least effective control but still important. Here, we see smart PPE with sensors to monitor worker vital signs, detect incorrect posture, or provide alerts for hazard. This hierarchy is a progression, and the higher level controls, such as elimination and substitution, should always be aimed for. And as alluded to in this matrix, technology provides us with powerful tools to implement these controls more effectively. Part 2 of the ILO's global report turns our attention to how we address occupational safety and health in the rapidly evolving digital age. It is not enough to just acknowledge the changes. We need to actively adapt our approaches to ensure worker safety and well-being. The ILO acknowledges that existing OSH frameworks remain absolutely crucial. They will remain the fundamental principles for safeguarding workers' rights, even as the nature of work transforms. These frameworks are the basis upon which we build our strategies for the digital era. As a sign of an inevitable future, governments around the world are beginning to integrate OSH considerations into their broader policies on AI and digital transition. This shows a growing global recognition that technology and worker safety must be developed in tandem. This proactive approach is also reflected in the updates that the ILO is seeing into legal frameworks. Laws are being revised to address the unique challenges of the digital world, including ensuring the safe use of robotics, establishing the right to disconnect in our hyper-connected world, and providing adequate protections for those in remote or platform work arrangements. Voluntary efforts are also essential. This includes the development of voluntary standards and guidance, the implementation of awareness campaigns to educate stakeholders, and the provision of training and support. Research plays a vital role in underpinning all of these activities, ensuring that approaches are evidence-based and effective. Aligned to the very first point of this slide, risk assessment and management take on an even greater importance in the digital era. Proactive identification and addressing of emerging digital risks is crucial. Finally, and perhaps most importantly stressed by the ILO, is the active involvement of workers and their representatives is essential in the design, implementation, and ongoing monitoring of digital technologies in the workplace. After all, workers are the ones most directly affected, and their insights are invaluable in creating safe and healthy digital work environments. The next two slides share some interesting excerpts from the global report that showcase examples highlighted by the ILO and that emphasize several key guiding points that were raised in this presentation as a summary of the global report. Of note, during COVID-19, an autonomous swab robot was developed that safely performed screenings without human intervention. Tested on 52 patients in Germany, it demonstrated high accuracy, high acceptance rates, and the ability to conduct up to 300 tests per day per robot. And since 2021 in China, for example, drones have been used to spray pesticides with over 200,000 drones in operation. These examples exemplify that the necessity for human safety can be both a driver as well as a case for innovation. This slide provides yet more excerpts from the ILO's global report that emphasize the document's message for ethical implementation, alignment with regulatory and training needs, as well as the role of the social partners in fair and safe technology adoption. Now let us shift our focus to Brunei Darussalam's occupational safety and health landscape. In terms of our legal and regulatory framework, under SHENA there are two existing legislations: the Workplace Safety and Health, Chapter 227, the Radiation Protection Act, Chapter 228. Under the Department of Labor, Ministry of Home Affairs, there's the Employment Act, Chapter 278, the Workmen's Compensation Act, Chapter 74. The Occupational Health Division under the Ministry of Health also provides occupational health services. Under SHENA's licensing and registration regime, SHENA possesses 48 active approved training providers, has 5 safety and health training course syllabuses, 463 workplace safety and health officers, 187 workplace safety and health coordinators, and 26 authorized examiners for lifting. This alludes to the growing sphere of influence within occupational safety and health that can not only provide insights, including supporting and opposing views into the discourse of safety and health, as well as AI implementation. The following slide is a capture of Brunei Darussalam's Digital Economy Master Plan 2025, which depicts some interesting statistics on our current digital landscape. There are some notable figures that we can consider. For example, according to the Brunei Darussalam ICT Household Report 2019, a significant 88% of households own smartphones. The same report in 2019 found that Brunei Darussalam's internet penetration was 95%. From a sampling of over 2,000 users, 61% of households use Facebook. Today, in 2025, we can safely assume that these numbers are now significantly higher and significantly different, perhaps even in context. This hints to an extremely high level of digital literacy and connectivity within the Bruneian workforce as well as the Bruneian population. This widespread adoption of mobile technology could be a significant enabler for the successful implementation of AI-powered OSH solutions, particularly those involving monitoring, communication, and data collection. It suggests that we as a population are already comfortable and likely to adopt digital tools in various aspects of our lives, including potentially in the workplace. As we consider integrating AI into our OSH practices in Brunei, it's crucial that we be realistic and acknowledge the potential challenges that lie ahead. The presentation highlights several key areas that may require mindfulness. Firstly, managing cybersecurity threats and ensuring the privacy of data collected through monitoring solutions is paramount. As we become more reliant on interconnected systems, safeguarding sensitive information becomes a non-negotiable priority. Second, there's the potential skills gap. Effectively utilizing and maintaining sophisticated AI technologies will require a workforce that's equipped with the necessary skills. Addressing this gap through training and education will also be essential. Thirdly, the application of AI in occupational safety and health is a relatively new context, and we need more evidence-based studies to fully understand its long-term impacts and ensure its effectiveness in our specific industrial as well as cultural environment. We also need to consider the inherent safety risks associated with mechanical failures in AI systems and the ergonomic design of wearable technology to ensure they are comfortable for use and do not introduce new physical stressors. Concerns around job insecurity due to automation and the potential for increased stress related to constant monitoring are also valid and need studied consideration. Finally, existing legislative and enforcement frameworks may need to be adapted to effectively address the unique challenges and opportunities presented by AI in the workplace. For example, when faced with a workplace injury or fatality, how can a regulatory body establish a root cause as well as a legal penalty in an automated workplace? Bridging these potential gaps, these potential scenarios will be crucial for realistic and ethical implementation. Yet, in terms of opportunities, AI can facilitate a new and vital context for discussion and collaboration between technologists and OSH practitioners. Bringing these two groups together can lead to innovative solutions tailored to our specific needs. The rise of digital work requires that we explore new safety and health considerations for these evolving job roles. We need to proactively define what protection looks like in the context of digital work and how AI can contribute to it. As we explore, this allows us the opportunity to evolve and become progressive in our anticipation of the future. Perhaps more significantly, AI can help us better manifest the traditional hierarchy of controls, a fundamental principle in OSH. For example, AI systems can continuously monitor work conditions like heat, noise, and air quality, providing real-time data for intervention. VR training, as we discussed earlier, allows for practice in hazardous scenarios without actual risk. AI-powered automation can take over dangerous tasks entirely, removing human workers from harm's way. AI has the potential to analyze vast amounts of data to predict hazards and proactively identify potential risks before they lead to incidents. As we draw towards the end of our presentation, we would like to leave you with some key takeaways and consider the path forward for OSH in Brunei Darussalam. It is clear that further research and perhaps pilot projects are essential to fully understand the specific impacts of these new technologies on occupational safety and health within our unique Bruneian context. In saying that, collaboration will still be paramount for building understanding as well as a positive safety culture around AI in OSH. This will potentially require close cooperation between industry, policymakers, and workers themselves, where open dialogue and sharing learning will be key towards proper and ethical use of new technologies. The emergence of AI in the workplace signals a need for newer guidance notes, updated frameworks, and potentially adapted enforcement approaches to ensure responsible and effective implementation. However, this would represent just one of the closing milestones for this journey that should still begin with research and collaboration. Finally, I would like to draw everyone's attention to the upcoming Workplace Safety and Health Conference, or WSHCon 2025, where SHENA hopes to make this conference a platform as well as an invaluable opportunity to dive deeper into these topics, network with experts, and further our collective understanding of how we can leverage on technology to create safer and healthier workplaces in Brunei. Thank you all for joining this webinar. I hope this reflection on the ILO's global report and its implications for Brunei Darussalam has been insightful. The integration of AI in OSH presents both exciting opportunities and important challenges. As mentioned at the beginning of this presentation, this is the very first in a series of webinars by SHENA in conjunction with World Day for Safety and Health at Work. Our last webinar in the final weeks of June will be a live session where we can interact virtually and ask more questions about each of the topics covered in this and other webinars. Should you have questions, please feel free to scan the QR code and leave them there. And as mentioned, we will have a chance to address them in a panel discussion during our very last webinar in June. We would encourage you to refer to the ILO's global report for greater detail, as well as look out for more information shared by SHENA on the upcoming WSHCon 2025 on SHENA's website www.shena.gov.bn or SHENA's Instagram and other social media accounts. Thank you, and together we can ensure Brunei Darussalam is a safe place to work and live. Have a safe day ahead.